My name is Dr. Hakan Şilek. I'm a neurology specialist. I'm especially interested in the sleep disorders. The sleep problems, sleep disorders are very frequent in society. The most of the important problems are sleep disorders like insomnia. We know from the medical studies that 20% of the population have problems with falling asleep and continuing the sleep. The reason of the insomnia and sleep disturbances can be very different, but most of them are stress, excessive use of nicotine, alcohol, caffeine, and drugs, and other systematic disorders. The most frequent cause of the insomnia are the excessive use of drugs, of nicotine, caffeine, and systematic other internal disorders. If we have problem with continuing the sleep and the quality of the sleep is very low, we are going to be sleep deprived. Why it's important sleep deprivation? Because sleep deprivation will result with neurologic problems, psychological problems, with metabolic problems and hormonal problems. And they are very frequent in people with the sleep disorders. The third question, and very important, is question: how long should we sleep? Well, this question is very important because in most of the Western societies, the sleep duration is known that we must sleep at least 7 to 9 hours. So if we sleep less than 7 hours, we are going to be sleep deprived. So this is very, very important. Another problem of the sleep disturbances is sleep apnea. This is very frequent sleep disorders, and we can find it in 5% of the normal, active, and young population. But with increasing with the age and obesity, the frequency of the sleep apnea is going to rise. Why it's important, the sleep apnea? Because the sleep apnea will cause the most of the neurologic problem. For example, neurovascular diseases. It can cause memory disturbances, and it is very, very important cause of the traffic accidents. How we diagnose the sleep apnea? The diagnosis of the sleep apnea is made in polysomnography rooms. We made a recording of the 6 to 8 hours, and after that the sleep specialist will check the report of the polysomnography. Is there any another sleep disorders than apnea? Of course, there are too many problems or diseases that can interrupt or it can worsen our sleep. For example, the most frequent of them are restless leg syndrome, anemia, chronic autoimmune and rheumatologic diseases. All of them will result with the sleep disturbance.